welcome once more to the third episode of Premature Ejaculation. It's a continuation. Now, in this video, we are going to talk about management of premature ejaculation. How can you handle it? Yes, it has happened, right? So, how will you handle it, right? So, I hope once again you will learn from this episode. And we'll continue learning, right? So let's continue interacting in the comment section. Tell us what was your experience with premature ejaculation. How did you manage it, right? And did you manage to solve it, right? Yes. So let's talk in the comment section. Let's interact in the comment section. And please, if you have not subscribed, please subscribe and like the video, right? Yes. So let's talk about management of premature ejaculation. So, premature ejaculation involves its management involves three strategies. One, we have something we call behavioral techniques, right? Behavioral techniques. Another thing, we have medication. There are medications that can help you delay your time of ejaculation. And lastly is about psychological counseling, right? So let me start with behavioral techniques. So in behavioral techniques, one is masturbation, right? So I'm not lobbying for masturbation, but study has found that it's one of the ways that help you to delay your ejaculation. How? So you can decide to do masturbation either 1 or 2 hours prior to sexual intercourse with your partner, right? So by doing masturbation 1 to 2 hours prior to sexual intercourse with your partner may help you to delay your time for ejaculation during sexual intercourse. It may help. It may or it may not help, but it has been recommended that it helps, right? So that's one, masturbation 1 or 2 hours prior to sexual intercourse. Yes, another behavioral techniques is pelvic floor exercises, or what we call the Kegel exercises, right? So basically, the pelvic floor muscles, they are located between the tailbone, that what we call the coccyx, and the pubic bone within the pelvis, right? So there are three types. There are basically three types of pelvic floor muscles. We have the pubococcygeus muscles, we have the iliococcygeus muscle, and finally we have the puborectalis muscles. That's not important. Let me just mention them. There are three. So weak pelvic floor muscles, right? It makes it difficult for you to delay your ejaculation. Do you get that? Weak pelvic floor muscles make it difficult for you to delay your ejaculation, right? So by strengthening your pelvic floor muscles by exercising them in what we call Kegel exercises will help you to strengthen the pelvic floor muscles, and eventually will help you to delay your time for ejaculation. You not perform for maybe 1 minute of honest work and you ejaculate. No, it may improve your duration for ejaculation, right? So to perform pelvic floor exercise, how can you do it? One, you have to identify the right muscles. You have to ensure that we are dealing with pubococcygeus muscle, we are dealing with iliococcygeus muscle, we are dealing with puborectalis muscles, right? So to perform pelvic floor muscle exercises, you need to identify the right muscles. How do you identify the right muscles, right? So during urination, during your time of urination, you can stop urinating midstream. Let's say you are urinating, then you stop when you are continuing to urinate. Just before finishing midstream urine, right? You are urinating, then immediately you stop urinating, right? It can help you identify the muscles. You feel the muscles, or you can tighten the muscles that keep you from passing gas, right? So these muscles, all of them you use the pelvic floor muscles. So one way of identifying the right muscles, or which you want them to be exactly, pelvic floor muscles, not the abdominal muscles, not the thigh, the muscles of the thigh, not the muscles of the buttocks. Specifically, the muscles of the pelvic floor muscles. So how do you identify? One, I've said, during urination, you stop urinating midstream. Immediately, you will identify the muscles, or you tighten the muscles that keep you from passing gas, right? All of those muscles, they use pelvic floor muscles, right? So after identifying the right muscles, the right pelvic floor muscles, right, you can now exercise these pelvic floor muscles in different positions, right? But initially, when you are starting, it's easier to do it when they to do the pelvic floor exercises when you are lying down, right? You can exercise the pelvic floor muscles when you're lying down. So after identifying the right muscles, or which I've said, you stop urinating midstream, or you tighten the muscles that control that keep you from passing gas. So after identifying the right muscles, now you exercise them. But initially, it's easier to do them when you're lying down, right? Yes. So to perform them, you have said you have to identify the right muscle. Secondly, you have to perfect your technique. You have to perfect, right? So while doing, let's say you started by lying down, right? So you have to hold the pelvic floor muscles at least 3 seconds, right? You tighten them and hold at least 3 seconds. And again, make sure they are pelvic floor muscles, not they are not abdominal muscles. You're not tightening the pelvic the muscles of the thigh or the muscles of the buttock. Pelvic floor muscles, right? You hold for 3 minutes, for at least 3 seconds, right? And don't hold your breath while doing the pelvic floor muscle exercises. Don't hold your breath, right? Just breathe freely. Just allow yourself to breathe freely. Don't hold your breath. Tighten the muscles and hold for 3 seconds and breathe freely. Don't hold your breath. And do this at least three times in a day. If you do it 3 times in a day, at least 10 times. If you do it, let's say you're doing it in the morning, you do it 10 times in the morning, 10 times maybe at noon, and 10 times in the evening, right? 3 sets of 10 repetition every day, right? Yes. So make sure they are the right muscles, the 3 muscles I've mentioned. Start by lying down. Doing when you are lying down, tighten it for tighten the muscles for at least 3 seconds, right? 3 sets, like morning, noon, and evening. 10 repetition each. So after tightening your muscles, maybe for let's say 3 days, when you're lying down, you can now start doing that when maybe you are standing, maybe you are walking, right? Or maybe when you're seated down, right? So you go step by step, right? Yeah. So the first one I talked about masturbating, which I'm not lobbying for it, right? I've talked about pelvic floor muscles, and I've told you how to do the pelvic floor muscles exercises. And thirdly, you do something we call pause squeeze technique. Pause squeeze technique, right? So in one way or the other, you and your partner decide to visit the healthcare provider. He or she may advise you to do something called pause squeeze technique during sexual intercourse, right? So how does this basically work? How does pause squeeze technique basically work? So what happens? You initiate sexual activity with your partner, right? Then you stimulate the penis until you reach erection, right? And until you are ready to ejaculate, you feel the urge to ejaculate, right? Then you pause. You stimulate, you initiate sexual activity, you stimulate the penis until you feel the urge to ejaculate. Then you pause. So you or your partner, one of you will squeeze the head of the penis where it joins the shaft, right? The head of the penis where it joins the shaft. The shaft, you squeeze. you squeeze for several seconds until the urge to ejaculate stops. Did you get that? Let me repeat. I've said you initiate sexual activity, you stimulate the penis until you feel the urge to ejaculate, right? Then you stop, you pause before ejaculating. You are in that moment, you feel there's urge to ejaculate, you stop, you pause. Then either you or your partner, one of you will squeeze the head of the penis, where the head joins the shaft, several seconds until the urge to ejaculate diminishes, right? So by doing this repeatedly, it reaches a point that you can have sexual intercourse. Maybe you can improve. You will be improving by time, right? Maybe you are premature ejaculation was lasting maybe for two minutes, or maybe 1 minute. After 1 minute of honest work, you may start improving from 2 minutes to 3 minutes, 3 minutes maybe to 5 minutes, slow by slow. It's a continuous process, right? Right? Yes. Pause squeeze technique. The fourth one is what we call stop start technique. Stop that start technique. That's the fourth behavioral technique, right? Stop start technique. What does it mean? Okay, when the pause squeeze technique, it may cause discomfort or maybe pain. If it causes discomfort or pain to you, you can use stop start technique. So basically, stop start technique is when you start sexual activity, you reach sexual excitement, you are sexually stimulated, you feel the urge to ejaculate, then you stop, you take some breath, maybe 1 minute or less, you stop, then the sexual stimulation diminishes a bit, then you start over again. That's what we call stop start technique, right? The fifth technique is use of condoms. So how does use of condoms help you to delay your ejaculation? You may be answering, you may be asking yourself. It plays a big role in helping you to delay your ejaculation. How does it happen? So this is the way. So the condoms, they reduce the sensitivity of your penis, the head of the penis, right? So the glands, I mean, they reduce the sensitivity, right? So if they reduce the sensitivity of the glands of the penis, what happens? The rate of sexual excitement reduces, right? Do you get that? So it helps you to reduce, to increase your time of ejaculation, right? It helps you to delay ejaculation. So they are specially designed. There are some that are specially designed climax control condoms. So this one they contain some things we call numbing agents. For example, benzocaine, for example, lidocaine. They contain them. So what that basically helps you in, they cause numbing effect. So if they cause numbing effect on your penis, it helps you to delay your time for ejaculation. So that is condom. And again, there are condoms that are made up of thicker latex. Thicker, they are so thick. So if you use such kind of condoms, they may help you to delay your time of ejaculation. Why? Because it reduces sensitivity to the penis. So the sexual excitement will be not that, the rate of sexual excitement will be a bit lower, right? So that's how condoms work in helping you to delay ejaculation. I'm done with behavioral techniques. I've mentioned about masturbation, right? I've mentioned about Kegel exercises, the pelvic floor exercise. I've told you there are three and how to do it. I've mentioned about stop start technique, squeeze, pause squeeze technique. I've talked about the last one. I've talked about condoms. Medication. There are medication. We have oral medication, but they can be used to reduce to delay ejaculation. However, they are not approved by FDA, the Food and Drug Administration Board. They have not yet been approved to be used in premature ejaculation. They include maybe antidepressants. You can use what we call selective serotonin reuptake inhibitors, the likes of paroxetine, the likes of sertraline, the likes of citalopram. They can be used. Why? Because antidepressant, one of the main side effects of antidepressant, they delay they delay ejaculation. So we use that side effect of delaying ejaculation to our advantage, right? So they can be used to delay ejaculation. However, they are not being approved. And again, don't use them because I'm saying that they help. Consult with your healthcare provider first so that he or she can recommend for you the right dosage and the right drug, right? So one is selective serotonin reuptake inhibitors, which is antidepressant, right? If it fails to work, your healthcare provider may recommend DCA, what we call tricyclic antidepressant, specifically clomipramine, right? So it can help you if SSRI fail to work, right? So another medication that the healthcare provider may advocate for is phosphorase 5 inhibitors. So these are basically used to treat erectile dysfunction. But if you can remember so well, we said that erectile dysfunction is one of the risk factors of premature ejaculation. So some of these drugs that are used in treatment of erectile dysfunction can also be used in treatment of can also be used in treatment of premature ejaculation. The likes of Vanafil, the likes of sildenafil, or what we call Viagra, right? Don't use Viagra because I've said it helps. Go to your healthcare provider, consult with him or her, so that he or she can recommend the right dosage, right? So that's oral medication. We also have topical lambing agents. The likes of we have gels, we have creams, or sprays that contain lidocaine, they contain benzocaine. They also help to delay ejaculation, right? So we have topical numbing agents, we have oral medication. But before you use this medication, kindly consult with the physician, consult with the healthcare provider. He or she will recommend the right dosage for you, right? Yes. We talked about medication, we talked about behavioral techniques. The last one is counseling. Counseling can help you a lot because one, majority of the causes of premature ejaculation are psychological. They are psychological. So counseling, opening up to your counselor, to your maybe psychiatrist, right, may solve almost 50% of this problem. So counseling is one of the main management techniques of premature ejaculation, right? So you may just see your counselor, just see your psychiatrist, open to him or her, tell him what's happening, right? So that it may help you in one way or the other, right? So I hope you enjoyed the video. I hope you learned. Thank you for the subscribe. Thank you for staying tuned. Continue supporting and continue subscribing. Right? Comment. What was your experience? Did you manage when you had this kind of problem? How did you manage it? Right? Did you have any treatment? Or what's your advice? How was the experience? Right? Yes, that is it for today. Thank you for watching. Thank you for subscribing. Thank you for liking the video. And let's interact in the comment section. Right? Yes.